Risk factors for CLL are of great interest to patients, as you might imagine, and we don't have a lot of great data on it. The primary risk factor actually seems to be having a family member who also has CLL, and that's associated with a 5 to 7-fold increased risk. Identifying genes associated with that has been challenging. There are families with apparently Mendelian inheritance where one can identify genes that are involved in CLL, but the mutations in those genes in those families are private to those families. GWAS studies have found over 40 alleles, but the combined relative risk of those alleles is only about 3-fold. We've had interest in trying to identify genes using exome sequencing of the germline, and we found that rare variants in ATM are enriched in CLL patients compared to patients without CLL. And one in particular of those alleles we found in 3% of our CLL population, and we were able to show that it is associated with reduced ATM function. So we're continuing to characterize these genes in ATM, or these mutations in ATM, to try and figure out which ones are important versus which ones aren't. And we're also doing new discovery in that space. Environmental risk factors, of course, are of great interest, and they're very hard to nail down because we don't know how long before a person gets CLL to look for an exposure. It's very hard to collect exposure information retrospectively, especially in patients who did get a disease versus those who didn't. There's going to be recall bias. There's been some implication of Agent Orange and glyphosate herbicides potentially in risk of CLL, but the data for the herbicides is actually quite mixed. So it remains challenging to sort that out. And then finally, having the precursor condition, monoclonal B-cell lymphocytosis, could be considered a risk factor for CLL. But in reality, probably MBL is really on a biologic continuum with CLL, and people who get MBL have whatever the risk factors are for getting CLL. And we just don't know what those are, apart maybe from some genetic ones. So it's still a ripe area for investigation.